Good morning, friends. The super meaning. This ultimate meaning necessarily exceeds and surpasses the finite intellectual capacities of man. In logotherapy, we speak in this context of a super meaning. What is demanded of each man is not, as some existential philosophers teach, to endure the meaninglessness of life, but rather to bear his incapacity to grasp its unconditional meaningfulness in rational terms. Logos is deeper than logic. A psychiatrist who goes beyond the concept of the super meaning will sooner or later be embarrassed by his patients, just as I was when my daughter, at about 6 years of age, asked me the question, "Why do we speak of the good Lord?" Whereupon I said, "Some weeks ago you were suffering from measles, and then the good Lord sent you full recovery." However, the little girl was not content. She retorted, "Well, but please, Daddy, do not forget in the first place he had sent me the measles." However, when a patient stands on the firm ground of religious belief, there can be no objection to making use of the therapeutic effect of his religious convictions, and thereby drawing upon his spiritual resources. In order to do so, the psychiatrist may put himself in the place of the patient. That is exactly what I did once. For instance, when a rabbi from Eastern Europe turned to me and told me his story. He had lost his first wife and their 6 children in the concentration camp of Auschwitz, where they were gassed. And now it turned out that his second wife was sterile. I observed that procreation is not the only meaning of life, for then life in itself would become meaningless, and something which in itself is meaningless cannot be rendered meaningful merely by its perpetuation. However, the rabbi evaluated his plight as an Orthodox Jew in terms of despair that there was no son of his own who would ever say Kaddish for him after his death. But I would not give up. I made a last attempt to help him by inquiring whether he did not hope to see his children again in heaven. However, my question was followed by an outburst of tears, and now the true reason for his despair came to the fore. He explained that his children, since they died as innocent martyrs, were thus found worthy of the highest place in heaven, but as for himself, he could not expect, as an old sinful man, to be assigned the same place. I did not get up, but retorted, "Is it not conceivable, Rabbi, that precisely this was the meaning of your surviving your children, that you may be purified through these years of suffering, so that finally you too, though not innocent like your children, may become worthy of joining them in heaven? Is it not written in the Psalms that God preserves all your tears? So perhaps none of your sufferings were in vain." For the first time in many years he found relief from his suffering through the new point of view which I was able to open up to him. Life's transitoriness. Those things which seem to take meaning away from human life include not only suffering, but dying as well. I never tire of saying that the only real transitory aspects of life are potentialities, but as soon as they are actualized, they are rendered realities at that very moment. They are saved and delivered into the past. Therein they are rescued and preserved from transitoriness. For in the past, nothing is irretrievably lost, but everything irrevocably stored. Thus the transitoriness of our existence in no way makes it meaningless, but it does constitute our responsibleness, for everything hinges upon our realizing the essentially transitory possibilities. Man constantly makes his choice concerning the mass of present potentialities. Which of these will be condemned to non-being, and which will be actualized? Which choice will be made in actuality once and forever, an immortal footprint in the sands of time? At any moment man must decide, for better or for worse, what will be the monument of his existence. Usually, to be sure, man considers only the stubble field of transitoriness and overlooks the full granaries of the past, wherein he had salvaged once and for all his deeds, his joys, and also his sufferings. Nothing can be undone, and nothing can be done away with. I should say having been is the surest kind of being. Logotherapy, keeping in mind the essential transitoriness of human existence, is not pessimistic, but rather activistic. To express this point figuratively, we might say, the pessimist resembles a man who observes with fear and sadness that his wall calendar, from which he daily tears a sheet, grows thinner with each passing day. On the other hand, the person who attacks the problems of life actively is like a man who removes each successive leaf from his calendar and files it neatly and carefully away with its predecessors, after first having jotted down a few diary notes on the back. He can reflect with pride and joy on all the richness set down in these notes, on all the life he has already lived to the fullest. What will it matter to him if he notices that he is growing old? Has he any reason to envy the young people whom he sees, or wax nostalgic over his own lost youth? What reasons has he to envy a young person? For the possibilities that a young person has, the future which is in store for him? No, thank you, he will think. Instead of possibilities, I have realities in my past. Not only the reality of work done and love loved, but of sufferings bravely suffered. These sufferings are even the things of which I am most proud, though these are the things which cannot inspire envy. Logotherapy as a technique. A realistic fear, like the fear of death, cannot be tranquilized away by its psychodynamic interpretation. On the other hand, a neurotic fear, such as agoraphobia, cannot be cured by philosophical understanding. However, logotherapy has developed a special technique to handle such cases too. To understand what is going on whenever this technique is used, we take as a starting point a condition which is frequently observed in neurotic individuals, namely anticipatory anxiety. It is characteristic of this fear that it produces precisely that which the patient is afraid. An individual, for example, who is afraid of blushing when he enters a large room and faces many people will actually be more prone to blush under these circumstances. In this context, one might amend the saying, "The wish is father to the thought, and the fear is mother to the event." Ironically enough, in the same way that fear brings to pass what one is afraid of, likewise a forced intention makes impossible what one forcibly wishes. This excessive intention, or hyperintention as I call it, can be observed particularly in cases of sexual neurosis. The more a man tries to demonstrate his sexual potency, or a woman her ability to experience orgasm, the less they are able to succeed. Pleasure is, and must remain, a side effect or byproduct, and is destroyed and spoiled to the degrees to which it is made a goal in itself. In addition to excessive intention, as described above, excessive attention, or hyperreflection, as it is called in logotherapy, may also be pathogenic. That is, lead to sickness. The following clinical report will indicate what I mean. A young woman came to me complaining of being frigid. The case history showed that in her childhood she had been sexually abused by her father. However, it had not been this traumatic experience in itself which had eventuated in her sexual neurosis, as could easily be evidenced. For it turned out that through reading popular psychoanalytic literature, the patient had lived constantly with a fearful expectation of the toll which her traumatic experience would someday take. This anticipatory anxiety resulted both in excessive intention to confirm her femininity and excessive attention centered upon herself rather than upon her partner. This was enough to incapacitate the patient for the peak experience of sexual pleasure, since the orgasm was made an object of intention, and an object of attention as well, instead of remaining an unintended effect of unreflected dedication and surrender to the partner. After undergoing short-term logotherapy, the patient's excessive attention and intention of her ability to experience orgasm had been de-reflected, to introduce another logotherapeutic term. When her attention was refocused toward the proper object, the partner, orgasm established itself spontaneously. Logotherapy bases its technique, called paradoxical intention, on the twofold fact that fear brings about that which one is afraid of, and that hyperintention makes impossible what one wishes. In German, I described paradoxical intention as early as 1939. In this approach, the phobic patient is invited to intend, even if only for a moment, precisely that which he fears. Let me recall a case. A young physician consulted me because of his fear of perspiring. Whenever he expected an outbreak of perspiration, this anticipatory anxiety was enough to precipitate excessive sweating. In order to cut this circle formation, I advised the patient, in the event that sweating should occur, to resolve deliberately to show people how much he could sweat. A week later, he returned to report that whenever he met anyone who triggered his anticipatory anxiety, he said to himself, "I only sweated out a quart before, and now I'm going to pour at least 10 quarts. The result was that, after suffering from his phobia for 4 years, he was able, after a single session, to free himself permanently of it within 1 week. The reader will note that this procedure consists of a reversal of the patient's attitude, inasmuch as his fear is replaced by a paradoxical wish. By this treatment, the wind is taken out of the sails of the anxiety. Such a procedure, however, must make use of the specifically human capacity of self-detachment inherent in the sense of humor. This basic capacity to detach from oneself is actualized whenever the logotherapeutic technique called paradoxical intention is applied. At the same time, the patient is enabled to put himself at a distance from his own neurosis. A statement consistent with this is found in Gordon W. Allport's book, The Individual and His Religion. The neurotic who learns to laugh at himself may be on the way to self-management, perhaps to cure. Paradoxical intention is the empirical validation and clinical application of Allport's statement. A few more case reports may serve to clarify this method further. The following patient was a bookkeeper who had been treated by many doctors and in several clinics without any therapeutic success. When he was admitted to my hospital department, he was in extreme despair, confessing that he was close to suicide. For some years he had suffered from a writer's cramp, which had recently become so severe that he was in danger of losing his job. Therefore, only immediate short-term therapy could alleviate the situation. In starting treatment, Dr. Eva Kozdera recommended to the patient that he do just the opposite of what he usually had done, namely, instead of trying to write as neatly and legibly as possible, to write with the worst possible scrawl. He was advised to say to himself, "Now I will show people what a good scribbler I am." At that moment in which he deliberately tried to scribble, he was unable to do so. "I tried to scrawl, but simply could not do it," he said the next day. Within 48 hours the patient was in this way freed from his writer's cramp, and remained free for the observation period which he had been treated. He is a happy man again and fully able to work. A similar case, dealing however with speaking rather than writing, was related to me by a colleague in the laryngological department of the Vienna Polyclinic Hospital. It was the most severe case of stuttering he had come across in his many years of practice. Never in his life, as far as the stutterer could remember, had he been free from his speech trouble, even for a moment, except once. This happened when he was 12 years old and had hooked a ride on a streetcar. When caught by the conductor, he thought that the only way to escape would be to elicit his sympathy, and so he tried to demonstrate that he was just a poor stuttering boy. At that moment, when he tried to stutter, he was unable to do it. Without meaning to, he had practiced paradoxical intention, though not for therapeutic purposes. However, this presentation should not leave the impression that paradoxical intention is effective only in monosymptomatic cases. By means of this logotherapeutic technique, my staff at the Vienna Polyclinic Hospital was succeeded in bringing relief even in obsessive-compulsive neuroses of a most severe degree and duration. I refer, for instance, to a woman 65 years of age who had suffered for 60 years from a washing compulsion. Dr. Eva Kozdera started logotherapeutic treatment by means of paradoxical intention, and 2 months later the patient was able to lead a normal life. Before admission to the neurological department of the Vienna Polyclinic Hospital, she had confessed, "Life was hell for me," handicapped by her compulsion and bacteriophobic obsession. She finally remained in bed all day, unable to do any housework. It would not be accurate to say that she was completely free of symptoms, for an obsession may come to her mind. However, she was able to joke about it, as she says, in short, to apply paradoxical intention. Paradoxical intention can also be applied in cases of sleep disturbance. The fear of sleeplessness results in a hyper-intention to fall asleep, which in turn incapacitates the patient to do so. To overcome this particular fear, I usually advise the patient not to try to sleep, but rather to try to do just the opposite, that is, to stay awake as long as possible. In other words, the hyper-intention to fall asleep, arising from the anticipatory anxiety of not being able to do so, must be replaced by the paradoxical intention not to fall asleep, which soon will be followed by sleep. Paradoxical intention is no panacea, yet it lends itself to a useful tool in treating obsessive-compulsive and phobic conditions, especially in cases with underlying anticipatory anxiety. Moreover, it is a short-term therapeutic device. However, one should not conclude that such a short-term therapy necessarily results in only temporary therapeutic effects. One of the more common illusions of Freudian orthodoxy, to quote the late Émile A. Gouthil, is that the durability of the results corresponds to the length of the therapy. In my files there is, for instance, the case report of a patient to whom paradoxical intention was administered more than 20 years ago. The therapeutic effect proved to be nevertheless a permanent one. One of the most remarkable facts is that paradoxical intention is effective regardless of the etiological basis of the case concerned. This confirms a statement once made by Edith Weisskopf-Joelson. Although traditional psychotherapy has insisted that therapeutic practices have to be based on findings in etiology, it is possible that certain factors might cause neuroses. during early childhood, and that entirely different factors might relieve neuroses during adulthood. As for the actual causation of neuroses, apart from the constitutional elements, whether somatic or psychic in nature, such feedback mechanisms as anticipatory anxiety seems to be a major pathogenic factor. A given symptom is responded to by a phobia. The phobia triggers the symptom, and the symptom in turn reinforces the phobia. A similar chain of events, however, can be observed in obsessive-compulsive cases in which the patient fights the ideas which haunt him. Thereby, however, he increases their power to disturb him, since pressure precipitates counter-pressure. Again, the symptom is reinforced. On the other hand, as soon as the patient stops fighting his obsessions and instead tries to ridicule them by dealing with them in an ironical way, by applying paradoxical intention, the vicious cycle is cut. The symptom diminishes and finally atrophies. In the fortunate case where there is no existential vacuum which invites and elicits the symptom, the patient will not only succeed in ridiculing his neurotic fear, but finally will succeed in completely ignoring it. As we see, anticipatory anxiety has to be counteracted with paradoxical intention. Hyper-intention as well as hyper-reflection have to be counteracted by dereflection. Dereflection, however, ultimately is not possible except by the patient's orientation toward his specific vocation and mission in life. It is not the neurotic self-concern, whether pity or contempt, which breaks the cycle formation. The cue to cure is self-transcendence. Have a good day, friends.